shot, I'm going to record some images from visible body to help explain this concept of the upper esophageal sphincter. I'm not sure if that was covered adequately. I'm pretty sure it wasn't in your summer anatomy course, which covers the ENT system. And I think that it is a good physiology concept, but I think that the physiology concept of the upper esophageal sphincter can get a little bit confusing when we're looking at actual structures. So right now I have a view that is the kind of a lateral or sagittal view of the upper part of the respiratory system. I've dissected out a lot of the accessory structures here, including a lot of the muscles that support the tongue and ligaments and things like that. What I want you to focus on here is just kind of where the esophagus is. So you can see that the esophagus is posterior in the body, that it sits posterior to the trachea, the windpipe. And then the next thing I want to call your attention to is the structures that are kind of in the superior aspect of the esophagus. So we have this superior pharyngeal constrictor. And if you kind of read medical or anatomical terminology well, you understand that this is the top muscle that constricts the throat. And then we have the middle one, and then we have the inferior one, and there's actually two parts of that. So that's the first part that I wanted to call your attention to, just in terms of where those muscles are located in a sagittal plane and how they're oriented with the esophagus here. So now I'm going to go ahead and go to my next view. Pull that up, and we'll go to the next view that I constructed here, which is a frontal or anterior view of the esophagus and the structures of the upper airway and esophagus. The thing that I have highlighted here is the epiglottis. So I'm sure that you're aware that the epiglottis plays a really important part in making sure that you don't have things go down the wrong pipe, that you don't choke on your spit, and you don't have food go down into your trachea while you're eating and drinking, and that is where the epiglottis is. It looks like it's kind of inferior, but I want you to remember that that can be a little bit deceiving. It does kind of control this muscle here that contracts and then it covers the trachea, which I'll show you here in a minute, when you are swallowing. So from this view, you can see it actually a little bit better. The epiglottis contracts and then it covers this area of the trachea. When I highlight the trachea here, you can see the vocal folds. And then I also want you to see how the esophagus is oriented here. It's kind of very posterior. And then I want you to kind of look at the way they've portrayed this in this diagram. You see how this kind of looks flat and round? And they have it as propped open because I think that makes it a little bit easier to see. But the normal resting state of the esophagus is it's closed. It is easier. It is an easier passageway than the trachea is because it doesn't have all these rings and it's not so far forward. So it's easier for things to go down into the esophagus than it is for them to go down the trachea, and that's to our advantage. Air can easily pass through here, but things that are liquid or solid more easily go into the esophagus. So now let's turn to what is this concept of the upper esophageal sphincter. So the esophagus is a tube. It's a tube the whole way down. There's no structures in the tube at all. It is just a straight tube. If there's a structure in this tube, if there's something solid in this tube that is coming from the body, then you have an abnormality present. But the concept of the esophageal sphincter, upper esophageal sphincter, is that you have this inferior pharyngeal constrictor muscle, which, remember that the top third of the esophagus here has muscles within it that are lined with the striated muscle tissue, and that these muscles here, these pharyngeal constrictors, as well as some other muscles that we're not going to talk about that are kind of support the throat and the airway, these are under semi-voluntary control. They are innervated in general by the cranial nerves, which come from the brainstem. And so it's a relatively primitive control that we have over swallowing. You know that we're swallowing even when we're still in utero. So it's not like it requires a whole lot of skill or training in order to be able to constrict your pharyngeal constrictors and swallow. But what they're talking about with the upper esophageal sphincter in particular is the last kind of passage or the last blockage that can occur to block off your esophagus or to allow things to pass through. And that is your inferior pharyngeal constrictor here. That is really what they're talking about when they talk about the upper esophageal sphincter, is that when the inferior pharyngeal constrictor contracts, it can help food either go down into the esophagus or come back up as you kind of choke on your food and kind of spit it up. And so the structure itself that makes up what we think of as the upper esophageal sphincter is not part of the esophagus at all. It is not something that you can see from inside the esophagus. It is, in fact, a muscle of the throat and kind of posterior neck here that is still under some voluntary control, again, controlled by the cranial nerves, relatively primitive, and it is that muscle which we think of as serving as the thing that allows the blockage of the esophagus or kind of expelling things back up through the esophagus. Remember, that's not what is protecting your airway. I don't want you to get confused about that. If your inferior pharyngeal constrictor is working, it can bring things back up into the pharynx, or it can allow things to go back, further down into the parts of the esophagus that are more smooth muscle. But it's not this that controls what goes into your airway. That's going to actually have to be more superior. When we talk about things that prevent you from having things that go into your windpipe, it's actually the epiglottis here which controls that, as well as some of the muscles that are kind of involved further up in the mouth and the oropharynx, involved in the swallowing reflex. And that, I hope, is not too confusing. I did want to talk a little bit briefly about the lower esophageal sphincter, but I will post that as a separate video. Thank you, everybody.